Welcome to ACTV Newsmakers. We're on location again, this time in Wheaton at the DuPage County Health Department. We happen to be within a construction trailer for a brand new facility that is under construction on the DuPage County campus. It is the DuPage Health Department's Crisis Recovery Center. And we have two guests joining us here in the construction trailer who know a lot about this project and the importance of bringing it to DuPage County. From the DuPage County Board, we have Board Chair Deborah Conroy. Chair, thank you very much for being with us. And from the DuPage Health Department, their Behavioral Health Director, Lori Carnahan. So welcome to both of you.
Thank you, Don.
Chair Conroy, we've talked about the need for mental health delivery services in DuPage County and how you folks have been a leader in it. But let's talk about that commitment that is being made here locally now with construction of yet another facility right here at the DuPage County campus.
Well, in DuPage, I think we're very fortunate because we are prioritizing the mental health wellness of our residents. And fortunately, we had the resources through the American Plan Act money. So we put $15.3 million into it from there. And that was a bipartisan decision by our board. Everyone is very vested in it. It is not a Democrat or Republican issue. It's a human issue. And I was also fortunate while I was in the General Assembly with the support of colleagues, including Tara Costa-Howard and Karina Villa. We secured $5.5 million from the state in 2019. So this is a process that's been going on for a long time and something that, so many people, particularly since COVID, have very strong commitments to.
Mm-hmm. And we have talked about the commitment that has been made in DuPage County. You have your council that's been established right now, various stakeholders bringing all these ideas to the table. How did this project get started, though? Was it an outgrowth of that council, or had you been working on this for some time?
No, this is a project. I want to say it was, Lori, correct me if I'm wrong, probably 2018 or 19. I first met with the health department in my role as a state representative. And that was when they started to talk about it. And that was kind of my passion and my lane at the state level. So we made a commitment to bring money from the state to help support that. We also did get some money from the federal government as well through Sean Casten, about $1 million there. So, in my years as a state legislator, I realized that it's the relationships you build with people and putting the right people in the room. And that's how you get things done. And I think this is a great example of that.
DuPage County has not walked away from the need for behavioral health, substance use intervention when necessary. And this is a very tangible result of the commitment that's being made here within DuPage County. Talk about that messaging, though. It's really important to get that word out that these services are available locally.
What I think we believe at our core in the DCSS, which is the group you were referring to, is that it's okay to not be okay. It is not okay to have nowhere to go. And that's what we're going to fix here in DuPage County. So we have 988 now, so we have somewhere to call. We need someone to answer and somewhere to go. And that's what we're providing here. In terms of mental health and addiction, the dual diagnosis is more prevalent than not in that community of folks that are struggling. So we want to make sure that we're able to deal with the whole entire issue. So this facility will not only have a rehab facility or detox facility and a mental health pod, it will also be the first to have a children's pod, a youth pod. And that is something incredibly important. I know Lori and I we've worked together at the state level. Lori's very involved in a lot of legislation and sees things firsthand on the front lines. And we saw a huge crisis with children and no resources. Parents constantly saying, I don't know what to do. I don't know who to call. Has
this been more of a post-pandemic issue than ever before?
No, and I know Lori has her stories as well. When you're in your third term as a state representative, you get a committee. And at the time I told the speaker, I said, I would like to have the first mental health and addiction committee for the state because I want to make it a priority and tell our state this is important. And I was told I was crazy and there was no money. And I agree, I'm crazy, good with that. And there was no money at the time. But if we don't educate people as to the need, when there are resources, we have no foundation where to grow. And so, I had quite a reputation of begging and borrowing. I never stole. But every time there was a new revenue source, whether it was gaming or it was legalizing something, we made sure a percentage of that money went to mental health and or addiction.
How does this break down barriers? And I'm talking about within even family units, the stigma, we don't want to talk about this effect, which then just permeates out within a community and beyond.
Well, Don, I would say we've made a lot of progress in terms of stigma. COVID was a kind of a twisted gift to that. It helped us a lot because I don't know that there was anybody that went through that isolation or that time that didn't tangibly understand a struggle with their mental health. Whether you were isolated, which could lead to depression. There was no kind of human interactions going on other than it brought us Zoom. It brought us things along those lines. And so people did start to talk about it more. I think substance use got a lot worse during COVID. Typically we find that when you have a substance use disorder, it often is masking a mental health struggle. So those are all things that we've learned. We've had a lot of celebrities, a lot more people coming forward. It's commonplace now to hear a parent talk about their high school child struggling with their anxiety. Everybody has anxiety, right? We all have it. It's how we deal with it. And so, sometimes if you have a stomach ache, you may need Pepto-Bismol. If you have an appendicitis, you need to get medical attention. So we need to learn the difference and learn that it's okay. I mean, nothing works in our bodies if our brains aren't healthy.
Right. What is your ultimate goal? What do you want to see come out of this new center? And then we'll talk to Lori about kind of the mechanics and how this is all going to work. But
Absolutely.
From all the years that you've worked on this state and at the county level, what do you want to see come out of this?
I want families, I want parents, I want anyone struggling to know that they have a warm community setting, place to go where their needs will be, they'll get a treatment plan. Mm-hmm. They'll get a soft kind of, it will be a welcoming place. It's not going to be any different than if you break your leg. We want you to feel comfortable. We want you to come and see us. We want you to meet the people, the amazing people that will be working in this facility. And we want you to get on your road to recovery or support, whichever it is. Sometimes people need support to get through so they don't hit a crisis. That's what we would like. We would like less people in crisis, more people in treatment and understanding.
Now, Lori, you are the Behavioral Health Director at DuPage County, so that's got a lot of weight coming with it right there, as I think we're going to learn. What is this facility? Can you talk about what this service is going to be providing, the actual physical construction of it, and we're talking about hospital type setting or emergency room or something different than that?
So a little bit different than that. The crisis recovery will really be that final piece of our full crisis system, which is that somewhere to go. So currently within our county, we have the someone to call, we have someone to respond, and someone to call is 988 or our county crisis hotline. Someone to respond, we have mobile crisis teams going out into the community. But building the Crisis Recovery Center is really building that final piece of the system for that somewhere to go. So this is where, as the chair mentioned, adults, youth that are struggling and their families have a place to go to be met in a safe, warm environment, to meet with mental health and substance use professionals, and to really have that time to work through their crisis and be effectively linked to community resources, so they don't have to go down the path of crisis again, and that we can really shift their path to recovery and give them all of the resources that they need.
Inpatient facility, how does this work, then the mechanics of all this?
Yeah, so this is an up to 24-hour facility. So this is really allowing people to have time and space to really decompress through that crisis, but it's not needing that inpatient level of care. When we talk about crisis, most often people need time and space, support from family and mental health and substance use professionals, and they don't have that time if they're sitting in an emergency room or if 911 has to be called, because then it happens really, really quickly. And so we find that with that time and space and with support from the right people in the right moment, like those professionals and those with lived experience, they have the opportunity to de-escalate and really stabilize in that moment, and then go home and go back into the community with the resources they need.
Or perhaps to another treatment facility.
Absolutely.
Here in DuPage County, for example. Who staffs a facility like this? Do you have crisis counselors? Do you have your mental health therapists on board? Who would be your primary staff on something like this?
Yeah, so we have a wide variety of staff, which is really what is needed in this type of facility. Crisis counselors will be there to do evaluations. We do have people with lived experience to give that extra support, extra effort. We have nurses, we have prescribers, whether it is a psychiatrist or a psychiatric nurse practitioner. We have community support specialists, people that can really then connect and link them back to community resources. So it's really a whole lot of individuals that are working together to make sure people get what they need.
Yeah. What forms of outreach have you taken upon as the health department and your team here? Who have you been working with to get this facility to the point where it's going to be ready to roll? I think out next summer or 25 is what I'm hearing, right?
August of 2025.
Great. Yeah, but you had to do a lot of work ahead of time, as the chair mentioned earlier.
Yes, absolutely. This is an entire community effort. So we have been really making sure that we're engaging with hospital systems, elected officials, schools, community mental health and substance use providers, fire, police, really every person that's going to be touching this facility. We not only want them informed, but we want them engaged in the process. So we've had stakeholder groups going on for a couple of years. For an example, we had EMS and police really look at the design on the front end because we want them to be able to drop off people voluntarily. But what do those systems need, right? We're working with community stakeholders on the other side of it. What resources are available? How do we effectively link? So we've been really getting involved with all of those key stakeholders and really making sure they have an input. And then for the community, we launched a speakers bureau in July. So any organization, any community that member that really wants that understanding and information about the Crisis Recovery Center, they can reach out and we can come and provide a presentation about it.
You mentioned working with first responders. Can people also come here just voluntarily when they feel this is the first place they need to go?
Absolutely. And that is why it's so important to get the word out into the community because even now in our crisis services, mostly individuals are coming in or their family members are taking them in, but we want it open to, really there's no wrong door and there's no wrong way to be brought in.
Very good. Now, can you just touch very briefly, and then we'll ask the chair for some closing remarks. But what are the services that are available right now? You've kind of touched on them, the who to call, how to respond, so on. But let's just talk about that, and then bringing this new component into it, which is really going to be, I think, a centerpiece of your entire operation, because this gets people in and gets the help that they need.
Yes.
Can you just kind of talk a little bit about the services that are available now?
Sure. Yes. And that is really the someone to call. So 988 is a nationwide network. And so actually they shifted the way that the calls are being routed pretty recently. And so now if you're calling 988 and you're in the DuPage County area, you're going to get our center. So you're going to get connected to that support and intervention over the phone and connection to those local resources. We have our county hotline, which is really parallel to what 988 does. It is just more of a well-known hotline because it's been in existence for so long. And we have those mobile crisis teams going out into the community. So that is a counselor and a person with lived experience coming to that person in crisis. De-escalating, providing intervention, doing all of those things to make sure they can stabilize.
Right.
And lastly, we do have a version of Somewhere to Go right now on our campus, and that is a 12-bed open and unlocked facility for adults with mental health struggles where they can actually stay with us for about 3 to 5 days.
Yes, and now bringing in the youth component too, as the chair mentioned, something that is now on the radar a lot. And I imagine schools are going to play a big role in this because now they'll know these resources are available also, right?
Absolutely. Yeah. So, and getting out there to schools as well. But it is, when people are struggling and they just don't know what to do, now you'll know if you're having a mental health or a substance use crisis, you have that one place to go to get the intervention that you need.
Timeline for opening then of the center.
Summer of 2025.
Great. I'll bet it'll be a big, great grand opening too.
Oh,
Who are you going to invite, Chair? You got a lot of people you want to invite to that.
It'll be wonderful to invite all kinds of people, but the people I look forward to welcoming are people who have had nowhere to go for a long time. Those are the people I'm excited to welcome.
You'll have to invite the speaker so he can see what you did.
Yes, I absolutely will invite the speaker and the governor.
And the governor, you bet.
Yes.
You bet. Your final thoughts on this? We're really very happy that we could bring this to our viewers, to our audience. We are literally sitting amongst the construction at this time. You wouldn't have had us here if you didn't think this was really important to show right now.
It is really important.
We're very grateful to it. What are your final thoughts on when this project is ultimately completed?
I just, I think a lot of us who have been working in this space for so long never thought that this would ever happen. When you talk about stigma, we had so much of a struggle just getting the conversations to be had, right? And now those conversations are out there. And so many people have had to suffer kind of in quiet, almost silent shame. And it's like, how can we ever have thought that when you struggle with an issue with your brain and your overall well-being, it's something you should hide or be ashamed of? And I want that to be something that, when my grandchildren are, if I'm around that long, are, getting older, and they would say to me, hey, Grandma, I don't understand. Why did you guys not think the brain was important? You thought the heart was, you thought that, the stomach was, all that kind of stuff. I don't understand. So I think for me, it's okay. People need to know we all struggle. It's okay not to be okay. And now it's going to be okay because we have somewhere for you to go.
Yes,
and we want you to feel that.
You've elevated DuPage County into that because that impacts the entire community
That's
when
the
people
goal.
suffer.
That's the goal.
Yeah,
Absolutely.
and you've addressed that.
This is a community issue, and hopefully not just those who are struggling, but those around them will embrace it and support them.
Very good. Chair Deb Conroy of the DuPage County Board and Lori Carnahan from the DuPage Health Department, their Behavioral Health Director, thank you very much for bringing our viewers in today. Kind of a behind-the-scenes look, a really great look at the new Crisis Recovery Center under construction now on the campus here in DuPage County in Wheaton with a scheduled opening of summer 2025, and you'll hear more information coming in the near future. Thank you very much for joining us today, and thank you for being with us on ACTV Newsmakers.